Hello friends and welcome to Gesundheit Kitchen. I am Hans Rueffert and I am joined today at the Cancer Support Community in Atlanta by my friend Alison DeVries, who is a registered dietitian and also someone who specializes in folks like me without a stomach, which I really appreciate you sharing your knowledge and your acumen and your wisdom with us. Want to talk about blood sugar is a topic that I have to worry about a lot, and I finally got one of those fun, it was so trendy. Everybody was getting a continuous glucose monitor. I thought, I need one of those, but it has been a game changer for me. And to be able to, in real time, get alerts and updates from when I eat every 3 or 4 minutes. It shows me where my blood level is, blood sugar level, and it has been just like a glass bottom boat into my own eating habits.
Right.
So let's talk about your experience and thoughts on that.
Yeah, I mean, I think they're great. They're a wealth of knowledge to learn about. We've talked about how everybody is very individualized, and that can give you personal data. Unfortunately, they're not a routine part of the care for people undergoing gastric surgery, which is unfortunate, but for people who really need them, you can work closely with your team and hopefully get a continuous glucometer if that's something that would support your care.
Well, and I think that relationship between what we eat and how we feel is at the heart of all nutrition, right? We're always trying to feel better. Yeah. But the blood sugar aspect of it has always historically been sort of, shoved over to the diabetic side, right? Yeah. Or hypoglycemic. And so it wasn't until I had really struggled with nutrition and being a chef, and that was my professional trade. I was maybe a little bit kind of arrogant, thinking I know all this stuff. But it wasn't until somebody said to me, you need to pretend you're diabetic. And I started to understand that relationship between the glycemic index and even realizing that all foods have a different glycemic index, right? I mean, it seems almost so kindergarten now looking backwards, but honestly, I was never taught any of that. And it's not common knowledge. So just in the broadest of strokes, let's talk about sort of high glycemic versus low glycemic foods.
Yeah, so any carbohydrate is going to be broken down into glucose. That's where we see glucose spikes, glucose drops because of reactive hypoglycemia. There are very simple sugars that don't require a lot of digestion to be broken down into glucose. Simple sugars are going to have the higher glycemic index. Those sugars are the ones that can precipitate early dumping syndrome. Those are the ones that can cause spikes in your blood sugar that cause reactive glycemia. So think about things like soda, fruit juice, your desserts. Also very refined carbohydrates like snack foods and things like that. Right. Other things that are more moderate glycemic index are going to be more complex carbs, but maybe the varieties that don't have a lot of fiber. So plain white bread, plain white rice. But then we can go to foods that have very low glycemic index. Those are going to be foods that are much higher fiber. Maybe they have the option to produce some sort of resistant starch. Those are going to be more foods like your whole grains and things like that. Your oats, that's a great source as well.
Well, definitely you mentioned something that I'm so glad you did about resistant starch, right? So because that is why when having a CGM, as all the cool kids are calling them, but the real-time feedback and my own story is that my wife and I had baked potatoes one night, straight out of the oven, and my blood sugar spiked to like 380, 400. I mean, it went straight up. So we'd read the sort of hack, and there's a lot of these things that are, on social media, and you don't know which ones of them are accurate or not accurate, but I'd read the thing about refrigerating or sometimes freezing that same food can make it starch resistant, right?
Yeah.
So we did the exact same meal the next day with the same potatoes, but they had been refrigerated for 24 hours, and it barely broke 150. Yeah. Same topping, same everything. So it was I was my own guinea pig.
Yeah. And that's the benefit of having this feedback mechanism.
Exactly. So talk about what makes it starch resistant.
So there are certain foods that contain a very specific type of starch that is in granules, little pockets. And when those pockets are cooked, they become gelatinized. And then when those foods are refrigerated, that gelatinization becomes a little bit more firm, which makes those starches resistant to absorption in the GI tract. It's a process called retrogradation. Foods that are able to have that change include potatoes, and it's actually different between different varieties of potatoes,
like
so that's very
potato,
interesting. Also oats, unripe bananas, so like your green bananas. What else?
White rice.
Legumes, white rice, absolutely. We're still learning more about this. There's certain foods that lose that resistant starch if they're heated back up. And that too is different variety from variety. So it's helpful to have that feedback data again that you have. Was your potato heated back up after?
Yes.
It was?
Yeah.
Okay, there you go. But oats don't have that same ability. So when oats are heated back up, they lose that retrogradation. You lose the benefit of the resistant starch. So for you at home, the benefit of a resistant starch is because it's resistant to absorption in the GI tract. It doesn't spike your blood sugar as much, so it can, like you said, stabilize your blood sugar over time. Also, that starch is food for the good bacteria in your intestine, so that's a secondary benefit as well.
Yeah, the term prebiotics, which it's become this new thing to put on a label now, but I mean it is important that we feed the gut bacteria what they need to eat, right? And encourage the right bacteria by feeding them the foods that they need, right? I think that's so super important. Well, I strangely, and I hate to even admit this, but my wife saw that on TikTok, right? So she saw a hack. So I don't want to say that TikTok is your go-to, but there is good information out there, right? And there are several social media accounts where people are just doing exactly what we're talking about. They'll make a meal, they'll record, here's my blood sugar beforehand, here it was afterwards. So that might not apply directly to you, but if this interests you, and at some point I think it almost has to interest you. If feeling better interests you, it's not a bad thing to watch that. Again, just don't try to take that data and 100% apply it to you.
Apply it to your unique situation, definitely.
But there are some hacks, for lack of a better word, some tips that can really change the way you look at the food you eat and how it's.
Have you experimented at all with white rice in this
we have.
hypothesis? How did that go?
Now I don't eat a lot of white rice to begin with, but yes, we have done with long grain. We like basmati as a personal, and it works great for that.
Okay.
Now I also love it straight out of my Zojirushi fancy rice cooker, but it will absolutely spike if I eat it the day I make it, if I refrigerate it overnight. And I've heard, though I've not tried it, that freezing it actually makes it even more starch resistant.
Yeah, I looked at that in the research. I didn't see much of a difference, but it would be interesting to see what it looked like for you.
So when you're talking to a patient, are these the kind of things that you recommend as well for folks? Or?
It's very individualized depending on where someone is at and what their eating looks like before surgery and what their eating looked like after surgery, really.
Well, I think that statement is true across the board, that there's obviously, we wish there was a simple one answer solution that we give to everybody, but sadly it's not one size fits all. But it is a bit of a journey to find out, and as we talked about, it's a timeline. So just because something didn't work for you 2 weeks after surgery doesn't mean that it's not going to work for you.
Your body's always learning.
Now, it was a bit of a challenge for me to get insurance to approve this, and so I want to talk a little bit about getting these. If you're meeting some resistance from your medical provider, well, let's talk about actually acquiring a monitor.
Well, first I would say look really closely at any trends in your labs, your fasting glucose, if a provider's monitoring your A1C. Those are definitive ways to get you coverage if you are someone who qualifies as having diabetes.
Sure, or even pre-diabetes.
Or pre-diabetes. To some degree, it's more common to get the coverage if you're using insulin and have an A1C in a range of true diabetes, but definitely that's some information that's valid and usable. With low blood sugars, it's a little bit more difficult to get insurance coverage for a continuous glucometer. But the best thing I can say is track your symptoms and track how those symptoms relate to when you eat, what you eat. Do those symptoms get better when you eat again? That's something that your provider can potentially use to write a letter of medical necessity and go from there. You can also think about asking your provider if they can get you a sample, maybe from a manufacturer, to use temporarily to gather data that might help obtain insurance coverage. Or there are some over-the-counter options that you could use just for a month, a few weeks, to gather some data that would help with coverage as well.
Well, and even while you're in the tedious, frustrating cycle of trying to get approval, going out of pocket to just for your own lifestyle knowledge, if you can track it for a month, I think that education alone is worth it, right? And everything is expensive, and so I'm not trying to put an undue burden on you. But if you can do it, just to have that window into watching those ups and downs to help train you, because it really has changed the way I look at food fundamentally. And I went into this experiment thinking I kind of knew something about something, right? But it really has changed. It's opened my eyes to a much wider. It's almost like I can see in a new spectrum. I can see in the infrared now. So I think it's worth it. Now, in some cases, and also in my case, I had to be referred to an endocrinologist. It was an endocrinologist that had to make the recommendation. And so, my oncologist from day one said, I think we should try this. She wrote the prescription for it, and it was immediately denied. So there was a period of then having to go see an endocrinologist and then explaining to them that no, I don't think I'm diabetic. But so it's a little bit of a hassle, right?
Yeah, and my suggestion there would be try to get an endocrinologist on your team as soon as you can.
Sure.
Most of our patients that we're getting ready for surgery, we'll try to connect them with an endocrinologist that works in our hospital to maybe address any high blood sugar issues before their surgery. But it's really, really beneficial to have them on the team afterwards, especially if they're an endocrinologist that kind of knows the ins and outs of how the surgery can impact metabolism.
Listen, I think that falls into that prehab side of things, and with living in a rural area, I was the only person my endocrinologist had ever seen with anything even remotely like this. And I was so impressed by the enthusiasm, like, wow, this is a new, because it's not the same thing, not calling the other ailments humdrum, but you know what I mean? It was refreshing to see that she took an interest, but not everybody's going to have that. So you do have to be your own advocate, or if you have a caregiver, get them to maybe be your advocate to kind of push for this. You might hit those walls, but it's worth it's worth the effort.
Definitely.
Totally think so.
And I will say there that in my opinion, more information is better, but some people watching those numbers go up and down can be a little bit anxiety producing. So I just did want to say it's normal for your blood sugar to go up after you eat. That's a normal part of metabolism. It's more about seeing how high it's going and how quickly is it coming down. So it can be really helpful if you do get the ability to look over this data, to go over it with an endocrinologist or even a diabetes educator or a dietitian to kind of help you interpret some of that, so that you're not getting worried for no reason.
That is absolutely great advice, because it is a little bit obsessive inducing. Like you want to watch it like, oh wow, I need a raisin, what's going to happen? So you can become a little bit obsessed with it. But again, it has trained me to kind of, not only do I know what foods are causing the ups and downs, I can feel it. Like I know that my blood sugar is right, and by getting the the real-time response, like, yep, I thought that was about to happen. So I don't want to say that I don't ever look at it, but I look at it now so infrequently. 6 months into it, right? So it is a tool, and like any tool, the shiny newness of it kind of wears off. But it's non-invasive. It doesn't hurt to put on. The whole experience to me has been overwhelmingly positive.
Great.
So, well, thank you so much. Again, this has been invaluable information. This is all information that I wish had just been handed to me on a platter at the beginning of this journey, and I'm so proud that that the information is out there and that you're connecting with patients ahead of their journey. I think this is great. And for those that aren't lucky enough to sit in the same room with you, thank you for sharing this.
Absolutely.
This is the kind of stuff that we all need to learn. For you at home, thank you so much. If you have questions, please don't hesitate to send them in. We will have some recipe episodes coming up on how to kind of incorporate the starch resistant in the series as well. Ideas and tips and tricks. Until then, take care of yourself, or if you're the caregiver, take care of your loved one. We need you. And until next time, be well. Gesundheit.